All right, let's dive into blood flow restriction therapy, BFR for short. If you're a physio student, you've probably heard about this technique, but maybe you're not 100% sure how it works or when to use it. So let's break it down step by step. First up, what actually blood flow restriction therapy? In simple terms, it's a rehab technique where I use a specialized cuff or band to partially restrict blood flow to a limb while the person exercises. We're not cutting off circulation completely, just slowing it down enough to create a controlled environment for the muscles. Why would I do this? The idea is to get muscle growth and strength improvements with much lighter weights than usual. Now here's how it works. When I restrict blood flow, I'm trapping some blood in the muscle. This makes the muscle work harder, even with low loads. The body responds by ramping up muscle-building hormones like growth hormone, and by recruiting muscle fibers that wouldn't normally activate with such light resistance. So you get the benefits of heavy lifting without the risk of injuring someone who's just had surgery or is dealing with pain. Let's talk about the step-by-step process. Step 1. I pick the right patient. BFR isn't for everyone, so I screen for things like blood clotting disorders or cardiovascular issues. Those are red flags. Step 2. I choose the right equipment. Specialized cuffs are best because they let me control the pressure safely and accurately. Step 3. I place the cuff on the upper part of the limb. So, high on the thigh or upper arm. Then I inflate it to the recommended pressure, usually around 50% of the limb's arterial occlusion pressure for legs, or a bit higher for arms. Now, on to the exercise part. We use really light weights. Think 20 to 30% of what someone could lift once, maximum. It looks easy, but trust me, it gets tough fast. A common protocol is 4 sets. First set of 30 reps, then 3 sets of 15, with short rests in between. The muscle starts to burn, but that's the magic happening. Why should you care about BFR? Because it can speed up recovery, help people regain strength after injury or surgery, and it opens up options for patients who can't tolerate heavy loads. But remember, safety first. Always monitor your patient. Watch for signs of numbness, tingling, or too much pain, and be ready to stop if anything seems off. So that's blood flow restriction therapy in a nutshell. Use it wisely and you'll have a powerful tool in your physio toolkit. Thanks for watching and keep learning.